Good evening, everyone. Thanks so much for taking the time out to join us tonight. We wanted to take this time this evening to try and update many of you who have been following the story of healthcare and fighting against healthcare cuts for not just months, but literally years. So we welcome you tonight. We are going to take this time to tell you with some specificity what it is we know about what is happening on Capitol Hill, what is contained in the budget bill that has gone through and been marked up in a number of committees this week. The congressional hearings that have taken place this week have put down in writing and voted what will be going into these bills. And what's happening is reflected in some of what you see on your screen right here. There has been a huge public outcry, headlines that are quoting a Republican Senator, Josh Hawley, that what they are doing is morally wrong. It's politically suicidal. The GOP, again, trying to cut Medicaid. It is a hard task. It is not getting easier. And they have put forward a plan to not only cut Medicaid, but also to roll back the Affordable Care Act, to cut SNAP benefits, to cut child tax credits, to cut education Head Start. They are cutting things that are essential for working families across the country. This is a war on the poor and on workers. Tonight, we're going to focus in specifically on healthcare. After a 26.5-hour long hearing in the House Energy and Commerce Committee, what we know are the actual details of the cuts, the rollbacks, and the restrictions that the Republicans are proposing to implement with the passage of their budget bill. It's important that we all keep in mind that these are not being done, despite the rhetoric, to improve efficiency, to improve access, to cut waste, fraud, or abuse. There is no evidence that there is the expansive fraud and abuse of these programs that is equal to the size of the cuts that they are making. This is being done for one reason and one reason only. It is both cruel and immoral. It is to give trillions of dollars in tax cuts to billionaires and corporations. That is the reason that this is happening. Many have called it, and we would agree, that this is a reverse Robin Hood scheme to take from the poor and give to the rich. In our view, this is repeal by another name. And I think you may understand why we say that as you learn what these cuts actually entail. Over the past decade, under the Affordable Care Act, millions across this country have gained access to healthcare coverage, many for the first time. States all across the nation have expanded Medicaid programs to help the working poor. Here in New Jersey, the number of working adults and number of people who have been able to gain access to Medicaid under the Affordable Care Act has ranged from 450,000 all the way up to 800,000, given the different years. What we have done here in New Jersey and across the nation have cut the uninsured rate in this country in half. But we're on the edge of turning back nearly all of that progress that we have made. And we do not say that to be alarmists. What you will see and hear tonight are the actual numbers that the New Jersey Department of Human Services has put out in their impact statement just today. The cuts, if implemented, would be catastrophic, and all of us will pay the price, whether we are insured by Medicaid or the Affordable Care Act marketplace. All of us will see increasing rates, increasing premiums, increasing costs due to the number of people who will be falling off of coverage. We hope that tonight's discussion will help you all understand exactly what this proposal is, who is impacted, and how. And what we're going to do is we're going to use the chat function. You can enter any questions that you have as we go through this presentation, which will not be real long. You can enter your questions in the chat, and we will take those questions following Laura's presentation and have a discussion and try to answer as many of those as we can. So for now, I'm going to turn it over to my colleague, Laura Waddell, who is New Jersey Citizen Action's Healthcare Program Director. Thank you all.
Thank you so much, excuse me, everybody. Thank you so much, Maura. We, all of this that Maura has been talking about, we just wanted to remind you who is being impacted. It's really everyone. It's our children in New Jersey. It's 1 in 3 children. It's our seniors in nursing homes. 4 in 7 seniors are beneficiaries of Medicaid in our nursing homes in our state. It is our people living with disabilities. 1 in 3 living in our state are enrolled in Medicaid. It's our low-wage working adults, 1 in 7 in our state. And so it really, all of this that that Maura has laid out for you is really affecting all of our folks and populations under the Medicaid enrollees in our state. And as Maura mentioned, the House budget reconciliation has $715 billion in cuts to healthcare. It is an immoral, I would say, the most inhumane budget we have seen. There are 13.7 million people who could lose their health coverage due to these cuts. For Medicaid, we're looking at specific populations. The Medicaid, what's called the Medicaid expansion population. And what this means is these are people who are currently enrolled on Medicaid, New Jersey Family Care Medicaid, who are between 100 to 138% of the federal poverty level. And just to give you a better idea, these are folks who make between $1,300 and $1,800 per month in regards to their income. And so some of the changes that we would see should this bill, budget bill, be passed, is that there will now be copay requirements for this target of people. This Medicaid expansion targeted population of people would be required to pay $35 when they go to the doctors. So right now, they do not have copays or out-of-pocket costs. Now they would be required to pay $35 in copays for their doctor's visits. Also included in this bill are work requirements. They are calling them community engagement requirements. So this would mandate this population of individuals to either work at least 80 hours a month, do volunteer work of 80 hours, or be enrolled in school. And so the folks who are who this would apply to, obviously adults, but adults who do not have dependents or children. And so parents, pregnant women, people with disabilities would be exempt, but the other population of adults would be, this would be a requirement for them. And so just to kind of give you an idea, in New Jersey, there are over 400,000 people who fall in this population. So that's a lot. And also, New Jersey Family Care just released a statistic that of the folks enrolled in New Jersey Family Care, they are expecting 1 in 5 or 20% of those folks to lose coverage, New Jersey Family Care coverage, because of all of the cuts and the threats that are inching their way closer to the finish line in Washington. This is to let you know that half of the expansion adult population would lose its coverage. So 50% would lose its coverage because of those cuts. That's over 200,000 people would become uninsured. I mean, that number is shocking. And we also see that there would be a reduction of federal funds, what's called federal matching funds that go out to the states. And so they have included a penalty to all states, New Jersey is one of them, all states who currently have expanded coverage, health coverage, to undocumented individuals. And we know that New Jersey has our Cover All Kids program that has over 46, almost 47,000 undocumented children enrolled. And that has been connecting these children to healthcare and coverage since its inception. And these children have been able to stay healthy and go to their doctor's visits and have medical treatments because of this program. And these are kids who are going to school with everybody's kids. And so this inhumane budget looks to penalize states like New Jersey with a 10% reduction in federal funding to the state because the state has expanded coverage to this population of people. This is looks to be about $3.6 billion that the state would not be receiving, a reduction of $3.6 billion annually in federal funding. This is an estimate that was just posted by our New Jersey Family Care Department of Human Services. So this is also a big impact of this new budget reconciliation bill. And so, Cover All Kids is definitely a program that's at risk. And I did want to mention that the states who, like New Jersey, who have been um, running these programs for our undocumented residents, they are being run with state-only dollars. So they currently do not include any federal dollars to run these programs. But even so, there is a penalty to the states in this budget bill. So that's just an unfortunate fact. Moving right along, we see that there are cuts to reproductive health. They are looking to eliminate all federal funding to Planned Parenthood, looking to cut all funding of abortion-related services, looking to cut funding for family planning services, cuts to the minimum staffing requirement for nursing facilities, canceling the retroactive coverage beyond 30 days. So as some of you might know, in particular, some of our folks in nursing homes, when you're trying to apply and enroll in family care, sometimes it can take a little bit of time. And so those residents would not be able to, typically, New Jersey Family Care will provide coverage for the services retroactively, and should this bill budget bill pass, coverage for retroactive services would not go beyond 1 month or 30 days. There's also it creates kind of a moratorium on new provider taxes, and these fund our state Medicaid programs. It bans Medicaid funding for gender affirming care, and makes eligibility reviews more frequent. So they would be every 6 months instead of every 12, which they are now. And I might add, it eliminates the continuous eligibility for our children's health insurance program as well. So we also want to highlight what the administration and the House is planning for in regards to policy changes to the Affordable Care Act marketplace. And so the first to note is the expiration of what they call the enhanced premium tax credits. And so nationally, that would be about 5.1 million, means that 5.1 million people would lose ACA marketplace coverage. For New Jersey, that means that 500 million in these tax credits, they would be ending at the end of this year, the last day of the year, December 31st. And this population of people is about 454,000 ACA marketplace or Get Covered New Jersey enrollees currently receive enhanced premium tax credits or enhanced financial assistance. So just to give you an idea as to how many people in the state that we're talking about. And when those additional subsidies go away, an individual's premiums would increase by about $1,260. For a family of four, it's going to be about $4,168. So just to give you an idea as to what those increases might be for premiums then on the exchange. And then we have more cuts. We have more cuts. As we mentioned, we would be removing the enhanced subsidies for those 454,000 New Jerseyans. Would be cutting in the enrollment period. And we would be cutting it from, it's currently 90 days. I know you all are probably familiar with the open enrollment period. That's from November 1st through January 31st. So that's 3 months, 90 days. It would go from 90 days to 45 days. So it would be November 1st to December 15th. And that's a big change. And also, it's a change because the state marketplaces have been able to create their own enrollment period length, but this is requiring all states to have the same 45-day enrollment periods. It would be adding more requirements to verify income, which really gives less time to resolve any application issues. It would make our DACA recipients ineligible to enroll in a marketplace plan. So it's estimated that there are 13,000 DACA recipients enrolled in New Jersey's Get Covered marketplace. Those 13,000 would lose coverage. It would also remove gender affirming care as an essential benefit and decrease what plans would pay for and increase out-of-pocket costs. And the marketplaces can terminate or deny future enrollment to people with past due premiums. That's a lot. That's a lot. And I will say that there are also threats to Medicare and in particularly, there are changes to the Medicare price negotiations. So I know a lot of you might be familiar with under the Inflation Reduction Act, there were it gave Medicare the power to negotiate drug prices, lower drug prices for initially 10 drugs, then the next year 15 drugs, and it built thereafter. And so these changes actually roll back that power to negotiate better prices for drugs. And so that lessening or loosening of that negotiation power will and also delays the implementation of the lower drug prices. So it's delaying the already negotiated prices that were due to become effective in January of 2026. So not all of the initial 10 drugs would their prices would be becoming effective at that point. And it's delaying the implementation of those drugs and others. And so New Jersey has an estimated population of about 1.3 million people enrolled in Medicare Part D, which is what this would impact. So there's impacts to Medicaid and Medicaid enrollees. There's impact to our ACA enrollees, our Get Covered state exchange and marketplace enrollees, and there's impacts to our Medicare enrollees and populations as well. So I wanted to just kind of go through this budget reconciliation process a little bit and just try to break it down and provide a timeline. So it's about, 5 steps. And each step, I would say, um, there are opportunities to influence the outcome of each step, depending on if there is the level of opposition, if there is a difference of opinions between the sides, if there's a difference of opinion between the houses in the legislature. And so there's a few things that influence how quickly each of the steps are completed. So the first step has already been completed. They have passed this framework, this budget reconciliation framework, and it has gone now to out of that House. The Senate has also passed its version of this framework, and now it has gone to the committees, the different committees, with instructions on, okay, now we have the framework. What are the particulars? What are the details of the budget that would achieve the goals included in the initial framework? And so that has just happened this week, within the last day, that the Energy and Commerce Committee and other committees have completed and passed their frameworks, details for their budget bill. And so we're in this step 2 area right now. And now that it's gone through these different committees, it needs to then go to the budget committee so that it can kind of reconcile what all of the committees have reported out. And after that happens, it will have to be be sent to the floor, and it will then have to be voted on by the full House. All of the congressional members will have to vote on the final budget bill there, and then it will go over to the Senate, and then the Senate will have to see if if they agree to what the House has, and the Senate has, a difference of opinion on different versions and provisions, then it will offer its changes. And so there's it could be a lot of things that go into that, or it could go a little quicker. I know the House has its own timeline. It wants to get all of this completed through the House by Memorial Day. I mean, they seem to be on track to do that, but it's anybody's guess as to if all of the budget members and the budget committee, and then all of the folks on the floor will agree and vote for this final product. And then, as I mentioned, then you have to consider the Senate has to review and agree. So they have to come together, and then the back and forth happens, and then ultimately they will decide on one bill that has to get passed out of both the Senate and the House. And then once that's resolved and final and approved and agreed upon bill gets passed out of both places, it will go to the president's desk to be signed into law. And so the budget that they are talking about is the budget for 2026, just to give you a point of reference. So I know that was a lot, and there's probably a lot of questions and comments in the chat, but I wanted to also mention that, you know, this is not over. Certainly it is, the window of opportunity is getting smaller, but it is not too late to raise our voices together, to call out our members in the House right now who have the ability to vote this down. They need about four members in the House to break ranks and vote no to these cuts. And New Jersey happens to have 3 Republican House members that you know, could be could bring us 3/4 of the way there. They are Representative Jeff Van Drew, Representative Chris Smith, and Representative Tom Kane Jr. And so the more that we can try and put pressure and try to call upon them to vote no to these cuts and to stand up for the folks in their district and really the people in New Jersey and the folks of the state, the better the chances that we have. And so one of the most effective ways to do this is to share stories of how these cuts would impact people in their districts. And so if you or someone you know would be willing to share your story, if you're enrolled in New Jersey Family Care Medicaid, or even in the ACA, and you would be impacted by these cuts, and you live in Representative Van Drew's, Smith, or Kane Jr.'s district, we ask if you would be willing to share your story. And we would like to work with you. There's a QR code here on the screen. We can also put it in the chat if you would like to share your story and tell your congressman just how much these cuts would hurt you or your family. And so do let us know if you are able and willing to share that. And let's see, I think, yeah, I'll give it to Mara to talk about how we all can join the fight. Oh, you're on mute.
Oh, sorry, all. So thanks for that overview, Laura. And before we get to that, we really want to take the time to answer some questions. So maybe you could stop the screen share momentarily, and we'll just go to some of the questions in the chat. As people are populating the chat here, I just want to say, you know, essentially what Laura laid out in the process is we're at halftime, folks. It's halftime in the game. We've got a long way to go to get across the goal line here. You can tell I had 3 boys. I'm using football analogies. I don't know why, but that's where we are. You know, there are, as Laura said, many opportunities and opportunities coming our way where we will be able to intervene, raise our voices, exert pressure, tell our stories, you know, and try to move the needle on this. in summation, from the many different categories of Medicaid, the various programs and the cuts, the Affordable Care Act, and some of the impacts on Medicare, New Jersey alone is looking at coverage losses that are estimated to be over 600,000 people. That's an enormous amount of people for us to see losing coverage. These are direct impacts. And just as staggering between, the various changes that we covered, we're looking at $4 to $4.5 billion in losses of federal funds coming into the state of New Jersey. That would be somewhere between 7 and 8% of our entire state budget. So these are big losses. While they like to say these are not cuts, they're huge. They're catastrophic, not only for individuals, but as New Jersey and states around the country look at developing their state budgets for next year, all of these cuts and the threat of these cuts are going to impact what happens in our state budget. So it is not legitimate for anyone to say, oh, we're not cutting things for people with disabilities, or we're not cutting things for seniors. There is going to be what is essentially a game of lifeboat that states around the nation are going to have to engage in to decide who is off coverage, not only to meet the requirements of this bill, but how they are going to work within a much more restricted fiscal environment with less money, less services to deliver. Someone has to lose. And our programs are not all siloed. They don't work that way. Someone put a question in here, which I really would love to answer, about what are the impacts on mental health. There has been a huge outcry from the mental health community. Medicaid funds a lot of mental health programs and services. One of the very first impacts I think we will see is that putting a required copay of $35 on services up to 5% of people's income in the Medicaid expansion is going to have huge implications. We are talking about people, as Laura said, who make $1,800 a month. They can't pay rent. We're also cutting their food stamps. We're cutting utility assistance in programs like LIHEAP. We're saying there's no more Head Start. We are cutting everything that surrounds the safety net of people who live at the very edge or are in poverty. And so it creates what is an impossible situation for individuals. And it also rolls back the enormous progress that we've made. States have had the ability to innovate programs. New Jersey has done a tremendous job in rolling out a number of home and community-based programs and services that have helped people particularly deal with mental health and addiction. All of those programs are in the mix when our Department of Human Services would have to solve the math equation. All right, you now have up to, $4 billion less to deal with. So it is not an easy problem, and it's really going to have devastating impact. So I hope that answers your question. Specifically, what service it will impact is hard to say, but I will say that you also need to keep in mind some of the cuts are coming from other places. Health and Human Services turned off several grant programs that allowed communities across the country to deliver mental health care in communities. They have already happened, and there are efforts to try and get those restored. But right now, many of those programs have stopped, and we heard firsthand testimony in the New Jersey legislature during the budget hearings that people had their addiction services and recovery interrupted, and programs had to close because the money was shut off overnight.
Yes, I wanted to kind of add to what Maura said, that the commissioner mentioned that there was about over $350 million in grants that affected mental health and substance misuse programs in the state, and that grant, or those grants, were turned off. And so, like Maura said, mental health has already started to become affected.
Mm. Thanks, Laura. There's a question in the chat, just for clarification. The negotiated price reductions for Medicare recipients on certain prescription drugs that are already in place and approved, are they at risk?
Yes, that's exactly what's happening, is that the first 10 drugs that were due prices to become effective in January of 2026, not all of those drugs will be included in the go live list. So only a certain number of those drugs will be prices will become effective, and some of the others will be delayed for a number of years after.
Not good news. I think I can answer this one. How will the cuts affect the positive changes the state of New Jersey Medicaid has started for the one-on-one? I'm going to assume that this means, the home and community-based services. Oh, to clarify, my question was regarding mental health and substance use. So how will it affect the positive changes of New Jersey Medicaid? So I'll start off by saying there are some global impacts and improvements that are rolled back if this was approved. And then I'm going to kick it over to Laura to give you some other examples that she may have at the ready. Things like continuous eligibility. Continuous eligibility was implemented by states like New Jersey and many others around the country to ensure that people who enroll in Medicaid do not have to come in and out of coverage multiple times. What statistics tell us is that just creates people who are sicker and unable to really get well and use the services that they need. So many states, under the permission of the Center for Medicare and Medicaid, which processes requests from states, have been granted the ability to just do verifications for enrollment on existing enrollees one time a year. And if you are approved for Medicaid today, you then can have continuous eligibility throughout this year. That has been a huge boost to ensuring that children get the vaccinations and the services that they need, that they're able to see a pediatrician, that they're able to stay covered all throughout a school year, and things like that. So that's some of the things that would change globally. The other thing that would change that Laura mentioned is during COVID, advocates from many organizations as part of NJ for Healthcare, the state's consumer health coalition, fought and worked with many legislators to launch the program that enables the state to open up our New Jersey Family Care Program to all children, regardless of immigration status. That program launched just after COVID, where we recognized and saw the number of children and families impacted, where we were telling people they needed to stay home, they needed to make sure they could take care of themselves and see a doctor and treat COVID if they became infected. Well, if you didn't have insurance, that's very hard to do. So the urgency to make sure that all of our children were able to access healthcare really came to the forefront. And we now have, as Laura said, 46,000 children in that program. All 46,000 of those children could become uninsured. And the policy that is being put in place to roll back what funding we receive is purely punitive. It is purely punitive. It is retribution for the work of state government who has found an effective and viable way to expand coverage. They are being penalized for doing so. So it is one of the meanest and cruelest measures in this bill that really just has a bullseye on people. And there's no reason for it because it is not federal funds that are used for that program. So with that, Laura, do you have specific instances of positive changes and what impact it would have specifically around mental health?
I couldn't say around mental health. I know that we mentioned about the grants, but so there are additional, harms that will come to mental health services. I will say in general, because of the reduced federal funds, this would apply, across the board for our Medicaid populations. But what the commissioner mentioned last week was if there are such drastic cuts into the federal funding to the state, she really has three options to her. That's to look to see who's eligible for to enroll in New Jersey Family Care coverage, to look at what services are being provided, to look at services, for example, optional services or services broadly, to see what the service offerings are and making changes to those, making changes to who's eligible, and then making changes to how providers are paid and reimbursed. And so that is those are the levers that she has to use if she has less money to for this program. And so, that the program obviously covers mental health and physical health as well. And so, yeah, that's about the size of it. I mean, a cut to a certain portion of the budget really affects everyone. Everyone who has coverage, because if there's less money to start with, there will have to be considerations about how and who that those remaining funds are used.
Yeah. Thanks for that, Laura. There is another question asked earlier that do the Medicaid copays apply to all users or just to a specific subset of people in the Medicaid program?
So the Medicaid copays are for the Medicaid expansion population. of people that up to $1,800 per month, those folks. If so the Medicaid copays will apply to them.
I have a
So,
direct question that was sent to me. Oh, sorry, Maura, go ahead and answer that first.
no, I was just going to say, so it's the population of people who were allowed to enroll in Medicaid as it was expanded under the Affordable Care Act.
Yes, so the people who make between $1,300 and $1,800 per month, those are the people that will now have to pay the $35 copays when they go to the doctor for their doctor visits.
Ariel?
Okay, I actually have a direct question that came to me. It says for Planned Parenthood, how much does the state fund? How many New Jerseyans will be denied services?
I do not know that number off the top of my head. I can tell you, just from having been in the room many times with our partners from Planned Parenthood, that they are one of the largest providers of reproductive health services, particularly for low-income individuals and those without insurance all across the state of New Jersey. They operate in many places where there are no other providers to provide those services, and they do, cancer screenings, women's health checks, mammograms. There are all kinds of services delivered through the Planned Parenthood clinics all across the state of New Jersey. But we actually had an event today. Planned Parenthood is speaking at that event in Rahway. So we can try and get you the specific numbers on that.
There are a couple of more questions in the chat if you want to take them, Maura.
Sure. There's a question in the chat regarding work requirements. How are they handling nursing home patients? Are they considered disabled? Yes. Nursing home patients are covered under, if they're in long-term care, they are covered by Medicaid. One of the changes, though, that is really worrisome, and the implications of just how this could even operate are very, very worrisome when it comes to nursing home patients, because they are putting in a provision in the bill that when you apply for Medicaid, if you're approved, your eligibility is retroactive to the point of application. They are now saying that Medicaid will only be retroactively applied for 30 days. So it is very unclear, especially for those entering nursing homes who have to apply for Medicaid. Sometimes that process can go on for as long as 6 months or more. So, nursing homes already, there is a problem with people who need to be in long-term care. There are not always enough beds for Medicaid patients and those who can't self-pay in nursing homes. So having a stipulation that it can only be retroactive for 30 days would be very problematic for seniors who are entering long-term care. So that, I am sure, is something that will get a lot of discussion, and there are a lot of eyes on that provision.
And I just wanted to say the language regarding this says mandatory exceptions include those under 19, pregnant, aged, and disabled. So those are the exceptions. And there's another question So it basically, yes. Adults, whether you're single or married, but adults that do not have children, those are who, within the Medicaid expansion population, that 1,300 to 1,800 per month income level, those are the people who would be required to have these work requirements.
Yeah. If your question was put in the chat, and it wasn't fully answered, or you need clarification, please enter that in. We are coming up on the 8 o'clock hour. So Laura, if you could put back up the slide. I just wanted to let people know what you can do from this point. We are just in the first 48 hours of this process of actually having the language. But what I can tell you is that Citizen Action and partners that we work with all across the state have been engaged in trying to get the word out, have opportunities for people to engage. We do have the slide, if you can find it
Yes,
on
I
the.
just wanted to say there was one more
Sure, go ahead.
question in there that there was a question in there that was that asked about cuts to housing and affordable housing and all that. And we just want to say we're talking about cuts to healthcare and the war on healthcare, but there are cuts to SNAP, to TANF, to housing, to the environmental protection. I mean, there are cuts across the board. We're just talking about healthcare, but we probably could, have about 5 or 6 other webinars devoted to those other issues.
Yeah, thanks for catching that, Laura.
Mhm.
So you can stay in touch with us if you are not already. You can go to a page on our website, njcitizenaction.org/stand up. That is where we have posted information about what is happening. We have here in New Jersey, we have 3 Republican members of the House. We have Jeff Van Drew, Tom Kane, and Chris Smith. Those 3 members could make up 3 of the 4 votes needed to stop these cuts. So, we have seen in the past Chris Smith stand up to fight for Medicaid. He did cast a vote in the previous administration to preserve Medicaid. So we are appealing to those representatives in whatever way we can. And we urge you, your family members, your coworkers, anyone who are in those districts to reach out to their offices. There is a QR code. We will be sending this presentation that we did with the information to all of you who registered tonight. Those of you on Facebook, you can go to njcitizenaction.org. We have a page, Stand Up, which will give you information of the implications and impacts of these cuts, particularly in the districts that I just mentioned. We have the information broken down by congressional district. So those fact sheets are there. You can download them. You can use them. You can give them to your representatives. We also are working with people from across the state to pass resolutions at counties all across New Jersey. We now have 3 or 4 that have been completed, and we will have several more that are coming up at county commissioner meetings. in counties across the state. If that is something you are interested in, you can use the link here and the QR code in this presentation to sign up and tell us you're interested in joining the fight, and we will make sure that we reach out to you with the information. The other thing that we know is happening, and this is a joint effort by many, many organizations, grassroots groups across the state, there are rallies, there are office drop-in visits, there are actions happening in the congressional districts of Smith, Van Drew, and Kane. People are knocking on their doors daily, dropping them a phone call, just to make sure that they understand that these are critical things that must be preserved, and we have to stop these cuts. So lots of opportunities to engage. Lots will be happening in the weeks and hopefully months ahead. So we urge you to stay in touch with us. Please reach out to us. We will forward this to everyone tomorrow. And you can always, if you are not already, follow us on our social media, where we will post updates as they become available. So we'd like to thank you all for joining us tonight. Just one last check on whether or not we have a new question. There is a rally tomorrow in CD7. That's right. Tomorrow is Friday. There is a rally in CD7. Pat, can you remind me, is that, I believe it is at Tom Kane's office at noon. If anyone is interested in that and needs the information, yes, it should be tomorrow at his office, which is now in Lebanon. They have moved from Bernardsville. Laura, can you, we can connect them, or Farial, someone is asking, what is our social media page? Could we drop that in the chat for people?
At NJ Citizen Action.
I'm putting in the link to Facebook. Facebook connects to all our other pages as well. Just give me a minute for that.
Okay. All right, we will put that into the chat so that you can find us. And again, we want to thank you all very much for joining us tonight, for staying involved in the fight. What I like to say is, you know, for those of you who were engaged the first time around, change is possible. We made it happen last time. We have defeated the repeal of the Affordable Care Act 68 times. We're about to make it 69. And so we invite you all to join us in this fight to preserve our healthcare and make sure the progress we made, we can continue to make. So please stay in touch. We will do all that we can to keep you informed and stay in touch with you. And we look forward to seeing you again, either in the streets, in the State House, or here on our Facebook and on our webinars. Thank you all so much. Thank you to Laura for your great work and the presentation. Good night, all.
Good night.